Pectus carinatum is a deformity of the chest wall where the ribs and the sternum protrude outward. It is typically a result of the cartilage part of the ribs that grows more rapidly than the bones around it.
What you see when you're 7 or 8 years of age is unfortunately not what you're going to have when you're 13, 14, or 15. It usually grows out of proportion to the patient's growth and becomes more visually and physically pronounced.
Patients usually will come to see us to find out about just what it is and what can be done about it. The first treatment option is the more invasive ravage procedure, where we actually make an incision in the chest and go underneath the chest muscles and remove those pieces of cartilage that are between the ribs and the breastbone that are responsible for the abnormal outward growth of the chest.
We do have a less invasive way of treating pectus carinatum now, which is centered around an external bracing system.
It consists of a larger square portion that has some padding beneath it in the front that goes against the chest to provide the pressure to correct the pectus carinatum. And then there is a metal bar that goes around and it opens on one side so patients can clasp it in place.
The brace works by applying external pressure to the area of the chest that is protruding. And as that pressure is applied, the cartilage and the bones of the chest will reshape and remodel. The initial evaluation involves coming in to see our team of doctors, nurses, and therapists, and we work together as a team in the bracing clinic. We actually take measurements on the amount of pressure that we need to correct the deformity of the chest, and we also take measurements of each patient's chest. After we take their measurements, we have a brace made exactly for them.
There's an ongoing process of follow-ups. It's more frequent at first. For the first 3 to 6 months, it might be monthly. After that, it might be every 3 to 6 months.
It does require significant commitment by the patients because they do have to wear the brace for long periods of time during the day. But the vast majority of patients that we see with pectus carinatum who do opt for treatment with the brace will be successfully treated with the bracing program.
There are a lot of hospitals that offer different types of bracing, but here at the Cleveland Clinic we use what we feel is one of the best braces on the market that's being offered only in a few places around the country right now.
Patients that come in to see a surgeon for something wrong with their chest usually have already noticed it, and it's already begun to affect their self-esteem and the way they view themselves. When a patient comes in and feels that way and we can do something to correct it.
Good. How are you feeling? Feel good about it.
It makes the surgeon and our whole team feel terrific.